Interesting numbers here. 80% of people catching the coronavirus in Tennessee are under 60 years old, but 80% of those dying from the coronavirus in Tennessee are over 60 years old. Fox 17 News' Alex Apple live in West Nashville tonight asking the question, are younger generations willing to make a small sacrifice for their grandparents?
Well, no matter where you go in the state, there are doctors that are having to watch patients in their final days battling coronavirus and having to do so alone, without their family there to surround them in their final hours because it's simply too dangerous for their family to be there. And this is being perpetuated by young people who are acting carelessly, who get sick, and then unwillingly transmit it to the more vulnerable population. If you're walking the streets of Broadway on a weekend night, your life probably isn't dependent on your wearing a mask. But your grandparents certainly might be.
I need people to realize that this is bigger than them.
The graph on the left shows younger people get the virus the most. An inverse of the graph on the right, which shows people over 60 are much more likely to die. On average, it's risky behavior in younger generations that spread the disease. While Dr. Martin Chaney from Maury Regional Health says Grandma and Grandpa face the consequences.
Is that too harsh of a way to look at this?
No, not really. It's a very interesting concept because if you look at the Tennessee data, the average age of a new case of COVID in Tennessee is around 38.
But the average age of someone who dies is 74.
Young people, they are acquiring it much more rapidly than the elderly or more vulnerable populations, but those vulnerable populations are carrying the burden of the disease when it comes to severe disease and death.
Nashville's double whammy is that minorities join the elderly in being disproportionately affected. Sandra Sepulveda represents a very diverse District 30 on the Metro Council.
While we go out and party on Broadway or go to a bar or whatnot, we're actually spreading that around, and it affects people in all walks of life, and it's affecting a lot of people who are older. And we have to take responsibility for that.
Sepulveda says the best remedy remains a mask and a respect for the consequences of carelessness. 15 to 18% of the people affected in Tennessee are minorities, and Dr. Chaney says minorities actually make up 30% of the state's deaths. The primary reason for that, most people cite access to good and affordable health care. In West Nashville tonight, I'm Alex Apple.
Dr. Deborah Birx with the White House Coronavirus Task Force came to Tennessee today specifically because of the alarming spread of the virus here. She says 100% of Tennessee counties need a mask mandate. Tonight, a large coalition of Tennessee doctors says we should not leave this up to the 95 county mayors, as a recovering pulmonologist explains just how bad this virus really is. After 2 weeks in ICU, Nashville pulmonologist Dr. Stephen Hyman hasn't been out long. He got the coronavirus trying to save COVID-19 patients.
It has long-term consequences of which I'm still affected. I'm a month out of this illness and still on oxygen and can't return to work.
Dr. Hyman suffered respiratory failure and has developed blood clotting problems. As hard as it is still to breathe, he wants to get this message out.
We have clear guidelines that determines that Tennessee is experiencing an extreme outbreak, and we have not got this under control to the point where it can be we can safely open schools.
That's why Marshall County first grade teacher Kristen Wargel is considering taking a leave. She's in the high-risk group for the virus.
I'm not looking to quit. It's something that I've put my heart and soul into for 10 years and I plan to do until retirement. But I am looking at a short-term leave just to protect my health.
Monday, an outspoken coalition of Tennessee doctors pressed Governor Lee to issue a statewide mandate. They say these maps, mostly green in mid-May, don't lie. Almost every county is now red with community spread out of control.
We cannot put this burden on teachers, parents, local businesses, and mayors. This has to be a united effort.
I asked how a statewide mask mandate would work.
How do you propose that be enforced? So far, no local police departments have issued any fines.
I would lead that to our legislators and to the governor to come up with a mandate that has enough teeth in it that it's going to make a difference.
The doctors say they'll keep trying to save lives in the hospital, but they need more elected leaders working to save lives before more people end up here.
I'm not trying to take away personal freedoms, but I do believe that we should be thinking about how we care for each other.
The doctors say we need that statewide mask mandate and a statewide plan overall rather than separate plans for all 95 counties. An update now. Nashville Mayor John Cooper extending bar closures and restrictions on transportainment vehicles like party buses until at least August 16th. The 10 p.m. restaurant curfew has no end date as of right now. Metro officers gave thousands of verbal warnings this weekend, but no citations for not wearing a mask so far. Despite video like this from Lower Broadway clearly showing partygoers not following the mask-wearing rules. Fox 17 News' Nikki Jenowitz live tonight downtown to explain all of the complicated reasons that Metro Police are not writing tickets at this point. Nikki?
Stacey, the simple answer to this question is that Metro Police say that the people that they're approaching and asking to put a mask on are doing just that. They also said that it's difficult to enforce this because the people that they are seeing down here without masks on are not from the area. It's not like these people are repeat offenders who they run into each and every day not wearing a mask.
Over the weekend, MNPD approached nearly 5,000 people and asked them to put a mask on. Just verbal warnings, no citations, no fines. While videos like this may not instill a whole lot of confidence their enforcement strategy is working, the department claims there's more than meets the eye, telling Fox 17 the overriding majority of the people officers are encountering or warning on Broadway are cordial visitors to our city who, when requested to wear a mask, do so, using discretion to warn and educate. Despite scenes like this, they have no intention of changing their approach. Mask advocate and Vanderbilt University Medical Center infectious disease expert Dr. David Aronoff agrees.
Well, I'd certainly like to see more people wearing masks in Nashville, and some of that may boil down to needing to do more messaging, even putting billboards or more signage.
Well, he believes the stigma surrounding masks has been greatly reduced as it takes some longer than others to get on board. Aronoff supports a softer approach, using citations as a last resort.
In very crowded areas where people are clearly violating the mask ordinance, and if they're not responsive to verbal warnings, then I do think that that's a reasonable next step. It's a difficult culture change to affect very quickly.
And officers also say that they're dealing with a lot of the medical exemptions to this mask order as they work to enforce it. And those issues, of course, include medical excuses, people who have some sort of a breathing issue where it makes it uncomfortable for them to wear a mask, which, as we've previously reported, I should say, those medical issues require no proof. Reporting live on Lower Broadway, Nikki Jenowitz for Fox 17 News, your co-red station.